Welcome to the Climbing the Charts podcast. I'm Angie Lawless, and I'm here with my co-host, Brandon Miller.
Today, we are honored and very excited to have Dr. Alex Jahangir join us on Climbing the Charts. Dr. Jahangir is one of the most recognized leader in his hometown here in Nashville, Tennessee, and a sought-after source nationally for fresh perspectives on confronting some of the great health challenges of our time. Alex has honed his crisis leadership skills as an orthopedic trauma surgeon and a professor of orthopedic surgery, medicine, and health policy at Vanderbilt University Medical Center. He is vice president for business development, vice chair of orthopedic surgery, and director of the Division of Orthopedic Trauma at the Vanderbilt University Medical Center, as well as the executive medical director of the Vandy Trauma Burn Unit and the Emergency Surgery Patient Care Center. A former member of the Metro Board of Health Nashville, he served 2 terms as chair and was named chair of the Metro Coronavirus Task Force at the outset of the pandemic, which was March 2020. And that appointment was made by then Mayor John Cooper. I think that's when I really first started seeing you a lot, when that happened.
That's when a lot of people started seeing you a lot.
Myself included.
In that capacity, Dr. Jahangir led Nashville's response, developing and implementing policies that mitigated the spread, bringing stakeholders across the city together, spearheading access to testing and vaccination for vulnerable communities, and also serving as the public's primary source for information about the city's massive effort to keep residents safe and healthy. Dr. Jahangir has been lauded for his community service with more awards than we can recite in this context. Just a couple examples include the Nashville Chamber of Commerce's Spirit of the Region Award and the Nashville Convention and Visitors Corporation Francis S. Guest Connector Award. He's also been recognized by Major League Soccer as a 2020 Community MVP for his service to the Nashville community and has been recognized 3 times so far in the Nashville Business Journal Power 100, which is also a very prestigious designation.
Actually, this could be old. Is it still at 3?
I don't know.
It's not. All right. Because I think we pulled this from 22, and so I think that it's probably more now.
And finally, Dr. Jahangir lives in Nashville with his wife, Helen, who's a speech pathologist, and their 3 daughters.
Welcome to the show, Alex.
Thank you all so much. I'm so excited to be here with you.
We are very excited to have you. I don't know how many people have. We always ask at the end, so you can think about it now. Who should we do this with next? And your name's come up a few times, and it's just super exciting. And is it true that you have done some hiking with Derek Huey?
Yes, and every morning, Derek Huey and I text about what we're doing physically that day and how we're holding up to each other as far as weight goes.
Oh.
And if I may, since we're on topic of Derek Huey, I think I may be the only one who has ever beaten him in his weight loss challenge.
Yes.
Which won a award of a trip to Miami for my wife and me, thanks to Derek Huey.
Oh, Derek, I mean, he is just, you want to make a bet with him because 1, he's really competitive.
So competitive.
And 2, he's going to have a good reward so that it hurts if he loses.
Yeah.
Yeah.
And I'm probably just slightly more competitive than even he is. And so it was great.
So you're going to beat him every time?
Yeah, but he might beat me subsequently. But we won't talk about that.
We won't talk about it. Yeah, so Derek was my old boss, and I will forever be grateful. Derek and Shauna, if our listeners don't know Derek Huey and Shauna Singh Huey, they're just 2 must-know people in Nashville. Okay, so because it's Music City, what do you listen to in the car? And if it's a podcast or if it's a book, it's okay.
It's neither.
Oh.
So I was just listening to Tribe Called Quest coming in, and then I've really gotten back to like the '90s hip hop recently.
Oh, nice.
Like oh my God, I was just listening to Skilo even earlier today, and then obviously the Death Row records and then Snoop Dogg, and so that's what I'm really on right now.
Nice.
So should Snoop Dogg be the representative for our country in international arenas?
I mean, you want to see a guy who knows how to brand himself well. I mean, it's really fascinating. I actually have watched how he's branded himself, and yeah, it's fascinating. So why not? I mean, everyone enjoyed him, and the fact that they call him America's grandfather when it comes to, like, it's really weird to me. Like, Snoop ain't nobody's grandfather.
Right, exactly.
But he probably is, actually, in reality. I don't actually know that for a fact. But
Yeah, no, I mean, for sure, but also could be like our teenage son, right?
That's right. That's right.
So,
Okay, so Alex, we understand that you immigrated to the U.S. from Iran during the Iran-Iraq War when you were 6 years old. We understand that your father spoke a little English, and everyone else basically in the family did not. When you arrived here, tell us about your experience, coming from Iran to Nashville in terms of, the community, the assimilation, maybe some of, how that shaped your worldview.
Yeah. So in 1984, so I was 6 years old, the Iran-Iraq War, the Iranian Revolution happened in 79, for context. The Iran-Iraq War lasted from 1980 to 1988. So in 84, I was 6, my brother was 4, and I suspect my parents saw that there's no real end in sight for this war. And so they felt that their 2 sons had no future. And so they made a hard decision. It's a decision that I often, when my kids were 4 and 6, I happened to be the same age as my father. And professionally, he was an associate professor in medicine, as I was at that time, and had a clinic. And I often wonder what I would do, but they made the decision. They're like, we got to get our kids out. And the way we got out is, my mom and my brother and me went to Germany. And in Germany, every day we go to the U.S. Embassy to get a visa. My dad was in Iran. So as long as, in Iranian culture, as long as the dad was back home, like, there's no way the kids and the mom would ever really leave. There's a perception of their people's minds there. And every day we would go to the U.S. Embassy, and there was no visa. And I remember this because you remember things like this 6. I also remember bombs and coming overhead and going to the bomb shelters. And then we went to Belgium. Somebody said, the U.S. Embassy in Belgium seems to give more visas. And so we went to Belgium and got a visa, came back to Germany and got our suitcase. And I don't remember this conversation because I wasn't on it. The phone call with my dad and mom, but apparently my mom called my dad, said, all right, we're going to come back and we'll go together. And my dad's like, no, just go. And so we flew on a Lufthansa flight from Nashville to Atlanta and to Nashville because I had an uncle that was a contractor here. And that's how we ended up in Nashville. And it's kind of a wild, like, people wonder, like, why the heck Nashville? But, you go to where you have support and you have family, and we have this amazing family of cousins my age. And then slowly every different fragments of my family moved to Nashville, and we have a really large family here now.
I think I read that you guys were maybe 9th or something out of 33 that eventually.
Yeah, that's probably right. Yeah, that's right. And it's so cool because, so my brother, who's 2 years younger than me, is here. And we all left.
He's been getting a little press lately.
He has been. My brother became the first Nashvilleian and the first Iranian male to go to space. And it's so fun. And my other cousin, who we lived with, by the way, for 6 months, whose father was a contractor, is running for Congress now. So it's really cool because, like, all of us came here, and then we all left in the 90s. And I think the Nashville, the 80s and 90s, like, it encouraged people to leave because there wasn't, per se, the opportunities. And if I'm just being honest,
that's the brain drain effect was very strong.
And so we all left, and I thought there's no way in heck I'm ever coming back. And because of the work of some people in the early 90s, and we'll dive into this later if you like, we all ended up coming back. And now, I have so much family that's come back, my brother, my cousins, grandparents. But yeah, Nashville to us, that's what happened. And the community to answer further your question, the community that supported us, I learned English as a second language at Scales Elementary in Brentwood. Wow. And Sesame Street, by the way. People don't realize the power of Sesame Street. I watched a lot of Sesame Street. I had my first volunteer job at what is now the Adventure Science Center. It was the Cumberland Science Museum back then, right? And that actually became my first minimum wage job. And then it's the first place I served on as a board member. So, like, this community has given me so much. I graduated from MLK, and actually I went back for the first time since graduating just last week when my brother gave a talk at MLK, and it was just so amazing seeing. And so this community is so supportive of us, and I think of a lot of Nashvilleians.
If you had to point to something, that changed in that span that made you guys as immigrants think, yeah, Nashville is a place of opportunity. What do you think the biggest thing was, or the biggest person?
I think then and even now, I think we'll dive into Imagine Nashville in a little bit. the cool thing out of the Imagine Nashville project that popped up that our researchers found only in one other place in the whole community, in the United States in 25 years, is a sense of belonging and the sense of there's this unique experience in Nashville that not only do you welcome people who come here, but everyone wants to help you, whether it's in business or in our case, coming in as just people who, we were fortunate, like we had some means and we had family, and people want to help you. People want to help you get a job. People want to help you learn how to play baseball. Like I still remember my first Little League baseball game. My parents had no idea about baseball. And the little things, the stirrups you put on the feet, we thought it went on our hands. So I went into the baseball game, had stirrups up my hand. And like, instead of people like making fun of me, like somebody helped my parents figure out, hey, those things go on your feet. And like, that's the beauty. That's the secret sauce of Nashville. Mm-hmm. And that was true in the 80s. It's true in the 90s. And it's definitely true now at a much bigger scale.
Yeah. So going back, just your dad, so we left the story, and I think I probably took us off course, but your dad's still in Iran at this point. Mm-hmm. And so then how does he make his way?
Eventually, I don't know the exact path, but he eventually, I think within the next 6 months, was able to find, probably also, again, through Germany was an easier entry point, found a way to join us. And
so it was, you could leave Iran without issue, but it was just getting into the States?
You can leave Iran if it didn't look like you were leaving for good.
Okay.
At least at that time.
Yeah.
And then the United States is it's very welcoming. In the 80s, it was only towards the end of the 80s, I think it became harder. So I have my dad's oldest brother and his 2 sons and wife ended up moving to Canada because by that point it became hard to come into the United States. But he, and I remember, you hear people, I just came with my suitcase and, we didn't come with much as far as physical possessions. We came with our health, we came with the support system. But that's how we eventually made it this way. And so I think about 6 months later, my father joined us and we built this life in America together.
Would there be any chance that could happen today?
You mean in Iran?
Mm-hmm.
No, I think I'll dive into it. I think Iran today especially is even worse than it was then. And I think there's a lot. I mean, I look every day at the decision. I show my daughters, I have 3 daughters who are 5th, 6th, and 8th graders now. And I show them when young women get killed because they show their hair. I show them when a whole generation has just no opportunity. And unfortunately, there's not really an outlet for those people anymore to go to a land of opportunity and have everything that I have gained. So no, I don't think it's in today's world. It's as easier for people both from Iran and probably most of the country to have these great opportunities you have.
Yeah, it's really sad. That was my sense, but I thought I might learn something new. One of the things that when I was reading about you that I think, quite frankly, impressed me most is the academic legacy that is your family. By way of example, you've already talked about your father being a professor in radiology in Tehran. And then also, I think what was most shocking is, my grandmother was a school teacher, and I can remember it was very impressive that she had graduated college and your grandmother had a master's. It made me wonder if you've got this healthcare background. If somebody just said you're in charge of Nashville's priorities today and they were health or education, and you're starting where we are now, and maybe maybe neither of those would be at the top, because I know we'll get into Imagine Nashville, which had its own set of priorities. But of those two, education or health, where would you start?
Oh, that's a superb question.
It's tough.
I think you look at Maslow's hierarchy of need, and I think you still need to have health and a feeling of security before you can start focusing on learning.
Yeah.
Without a question, education was always beating our head, and I still beat in my own kid's head. That is the key to the world. But if you're worried about where you're going to eat your next meal, are you worried about getting injured when you go outside your house? If you're worried about having a heart attack and being overweight, I don't think you can focus on learning.
But where is that break when you say, okay, well, the baseline is enough for a good portion of people. Now we need to focus on, bringing those people some generational wealth so that they can move up versus, I don't know. I'm not going to put this out there because I don't know what I'm trying to say.
Keep
but
going.
you know what? I'm trying to think through. It's
this is fun.
It's a tough question, right? It's like you do need health, obviously, before you get education. But at a certain point, you have to filter in, I think, that education to give the health,
That's
to give
right.
the food, to give the housing. And so
so here's the thing. I think all of us have a leg up in the United States. Okay. I don't think about the water I drink anywhere I go in the United States.
Good point.
In any house I go into, whether it's in a government subsidized housing or some ridiculous house in the wealthiest part of America.
Right.
I don't think about the air I breathe almost anywhere I go in the United States. I think, and a lot of, for the most part, especially if a child is in school, a child has access to meals during the school year, right? So there are some foundational things that a child or an adult or anyone in the United States we have, and we have irrespective of anything that's going on in the world, because we have, as a country, have prioritized this.
Right.
And I think that sometimes gets lost in all the vitriol of politics. Like, we live in an amazing place, and irrespective of who's in power, those fundamental rights or fundamental beliefs, they're not rights, but we've made them a right.
Yeah.
Our fundamental things are there. So I think as long as we as a country continue to prioritize these things and not degrade them, which I don't think we will. And also we have, while we don't have access to like every kind of health, if you're hurt, and one of the reasons I went into trauma surgery is it makes this decision very easy. We will get you taken care of. Now, will you get therapy? Will you get all this stuff? That maybe not, but fundamentally, if you're walking down the street and you get hit by a car, in this country, you're going to get taken care of. That's not true in other parts of the world. So I tell you all that, and again, I'm way probably off track.
It's fascinating.
But when you have all that and you have that peace of mind, then perhaps we can get closer and sooner to, all right, now I need to open up the key to the world. And the key to the world, I fundamentally believe, is an education, which then allows you to go into a great vocation or go into a great trade and then build wealth that allows you to then take your kids and maybe move to a different neighborhood or to give them opportunities that, again, the stuff my kids get now are crazy compared to what I got, which I only got because my parents made a really hard decision to give up all their wealth to move here and really hustle. And so
I think it is really powerful that you show your kids, what's going on currently in Iran, because if you think, that could be them, right? Very easily could be them.
I was just thinking about that. Like, I went to Cuba last year, and one of the things you read is, you can't drink water. And even a lot of the vendors on the streets, you want to buy bottled water, but a lot of the bottled water is simply recirculated tap water. Yeah. And so you can't even really buy, and then as you know, the entire power grid has failed the last week or so. So you just think trying to operate in those conditions, you can't exactly focus on, your physics test.
Yeah. But I love your point, because it's like those basics might make the priorities different in another country, because how lucky are we that we don't ever think about the air that we breathe? We just breathe it.
Okay, so since the pandemic, you've been a frequently consulted public authority for navigating healthcare crises. Prior to COVID, we understand you'd been on the Metro Health Board, have been appointed by Mayor Barry, who is now running a very interesting race for Congress against Mark Green. But you had
by the time this is out, we may know the results.
We'll have a result. But when COVID hit and Mayor Cooper appointed you as the chair of the coronavirus task force, did you feel ready for what was to come?
No, are you kidding me? Let me give you some real background. All right, I became chair of the Metro Board of Health. So I became a board member in 2017, and I replaced this person, Dr. Foster, who was like interim president of Meharry. Bill Clinton had nominated him to be the Surgeon General of the United States. Like, dude was real. Who the hell am I? I'm an orthopedic surgeon. And so I was very humbled by, and I didn't know Mayor Barry actually knew me at the time. And I still remember I got the call. I'm like, I don't understand what's going on, but sure. And so I I sat in the, it's a government U-shaped table, and I sat at the very end because I was the most junior person. Everyone else had like decades of experience on that board. And then somehow in between 2017 and 2019, we had gone through 3 directors. And so in October of 2019, when it was a new director search that was about to begin, it was felt that let's have a new board chair. And I was like, I've led executive searches through different roles at Vanderbilt. I can do this. And then I will step down and then I'll move on. Like it's good. We hired a new director. He used to start on March 9th, 2020. So Monday, March 9th. The first positive Nashvilleian was March 7th, 2020. It was a Saturday night. I had never met Mayor Cooper at the time. I was an orthopedic surgeon. I'd never even, I don't think, been to a press conference. Maybe I've been to one. I never have spoken at one. Let's be very clear. And that Saturday night, his office calls me and they're like, hey, you're like maybe the most senior health physician in the system. Like, I know you're a volunteer job, but can you just show up at this press conference the next day on Sunday and just tell everyone everything's gonna be fine? We got this. I'm like, sure. So I kid you not, I typed up a little like, and it might have been as simple as everything's fine. We got this. Right. I practiced in front of a mirror that night because we had a guest over for dinner, some friends of ours through kids' school. And I tried to keep this poker face. And my wife's like when they left, I was like, what the hell's going on? And I was like, well, this was going on. So anyway, I went to the press conference. I did it. And I was like, new director, here he is. I'm going to be gone. And I think all of us, I don't think while the health department here and bigger centers, we followed the pandemic. Let's be honest. I don't think anyone fully appreciated what it was going to be. Right. So I don't think anyone who says they were prepared is probably not fully accurate. So long story short, new director takes over March 9th. I try to help, and through my network, the beauty of Nashville, a lot of people are connected. I was able to lean on my network, and we came up with a plan. I wrote it. I even have a picture on my phone I can show you. Wrote it. I was at Avo, the restaurant. Yeah. Mm-hmm. And I went there recently. I was sitting there. I was like, oh my God, last time I was here. And it was the one, anyway.
And like Centennial.
Yeah. And one city. Yeah. But at that point, it was like it wasn't a trailer. It was like in a crate, right? Yeah. And I wrote this plan. I showed it to the mayor's office, and they were like, this is great. And then on Thursday of that week, they're like, we want you to meet with the mayor Friday. We want you to like head this task force. And I'm like, what's that mean? They're like 1 hour a week. You just talk about the mayor. Like the director leads, but you kind of just, you've got a network and you can help. I'm like, great, no problem. And then I promise to come to the end too. But then on...
that's what we thought.
So that was a Thursday. And on Friday, the mayor's like, we're going to have a press conference and we're just going to announce you as the person. And I'm like, okay. And then they're like, and I was just it wasn't even called the task force time. And then literally as we're walking, they're like, oh, you're going to be the chair of the task forch. And I was like, what? Like, who's on this task force? And then that second press conference was, in my opinion, a disaster. I typed up my remarks in the parking lot. And I remember that after our press conference, I was like, guys, I'm not a media guy. I'm not a PR expert. Like, we need help on this, and I need help. And the mayor's office called some people. And on Sunday morning, I met with Butch Spirit in his office, and he had assimilated this great group of PR experts. And they're like, what do you need? I'm like, well, somebody to help with remarks and have a spokesperson. And then if there's a crisis, help with that. They're like, okay. And then they pushed over their phone, one of the people, and it was at that point, TMZ was running what had happened on Broadway Saturday night. Oh, no. And at this point, cities had shut down, and they're like, what are you going to do about it? And I was like, I don't understand what I'm going to do about it. And they very astutely point out that the only person to declare a public health emergency at that time, this has changed subsequently, the lawyers would appreciate this, but at that time was the chair of the Board of Health. The mayor couldn't declare a public health emergency, only I could. And so we brought together, so Bob Cooper was the Metro lawyer at the time.
He was my old boss.
Was he? So I called him, and Bob's very proper. Yeah. And I was like, Bob, I know I got to notice a meeting, but it's like an hour, okay? Because we got to do this. And that started, so public health emergency was declared. And that started 2 years of everything we experienced. And I went from 1 hour a week to being everyday press conferences. And it was more than press conferences, but what was really awesome is I met so many amazing people. We got to mobilize so many great private partnerships. And at the end of all of that, our city had a better mortality and more rate than anywhere in the state. We've given out 400,000 free tests, which kept our hospitals free for patients. We found transfer centers that kept patients alive. Like, we did a lot. And so I'm really proud of the city and what we did, but oh my God, no, I wasn't prepared. That was your simple question led to a long answer, but man.
Well, but I think that's appropriate, because that's what I was saying. It's like, that's what we thought COVID was going to be, right? That's what you thought your job was going to be.
Yeah.
It was
I remember telling our employees, we got a couple weeks of this and we'll be back to normal.
Yeah, sure.
That obviously did not happen. But I think the lesson there is, say yes and figure it out.
Okay. Yeah, absolutely. Like, say yes more often. That Richard Branson quote. It's my favorite. But
okay, so kind of bring that point back. And I think a lot of people, including a lot of medical experts, media, thought Nashville, despite the early Broadway scenes, that Nashville really did a pretty great job of navigating the pandemic. And part of that, seemed like it was by helping to avoid the political polarization that you saw in a lot of places. Tell us about, I don't know if it was intentional or just how it came to be that the coronavirus task force, it did seem to involve, members that kind of anchored all parts of the political spectrum. And, was there any intentionality to that, or just was that sort of a natural?
So yes, short answer. Look, Mayor Cooper at the very beginning of that Friday meeting said, look, I need the task force to be led by science, let the experts lead it, and then be transparent and honest. What is so great about this community in this state is, like, there's a lot of people who want to just do good by our state, right, in our city. And yeah, they may have an R by their name, they may have a D by their name. Like, let's look at the people who are in these roles. And I would say a high majority than not are amazingly good people who want to do the right thing. And so what was great is, very early on, I had, again, this community is great. You can have relationships. I had a great friendship and relationship with Commissioner Lisa Piercy of the Health Department, Patrick Sheehan, director of TEMA, a lot of the governor's people, and the governor himself. What a great partner he was to the state for wanting to help the people of the state. And so I would say we would have regular conversations. For a while, the commissioner and I would quietly meet, and a few of the governor's staff too, quietly meet for like a cocktail somewhere, and like we'd be going the hole in the wall, and we're like, nobody here knows us here. But at that point, both of us are on TV so much, there's always somebody new. and I tell you this to say, it was a dialogue. And so there was times when, for example, I once really I really irritated them, let's put it that way. And we were able, because there's a level of trust that had been built. The commissioner called me, and I think the governor and the mayor spoke even, and I was like, it was not our intention, sorry.
Right.
And you know what? And I think it's amazing when it's personal relationship or professional relationship, if you have that level of trust and you know that occasionally you may cross that line, if you know that the other person was malicious, it's amazing how much good can be done. Yeah. And the same token, we partnered on so much stuff. So the testing sites around that we had for 2 years that gave over 400,000 tests, partnership between the city, Meharry, the state helped a lot. We had 10,000 people who got vaccines in one day in Nissan Stadium. The governor's office and commissioner's office were so involved with that, along with the state. And then there were certain things where I knew, like, especially as it became more political, we had frank conversations with the governor's office and with people, and maybe not through official channels. I'm like, look, if we do X, what are the implications of this? And we were able to do that. And for the most part, we were always aware of what the other person may or may not do. And the few times where we might have stepped over our skis, or the right terminology is, there was a level of trust that would allow them to know on both sides that this was not a malicious intent. It was just a misstep. And it really made for a great partnership that I will always be grateful for.
It's amazing how trust is at the base. You can't overstate it enough, right? It doesn't matter. It's at the base of a relationship. It's at the base of a business partnership. It's at the base of, I think that's what we're missing right now currently and this is a whole other conversation, but in politics nationally, in politics in Tennessee, is that we've somehow lost this trust. Building that trust and those relationships from the beginning, I just think it's a game changer.
Yeah.
Brina and I do another podcast for our real estate company called the Real Estate Mailbag. And we had these 3 prominent real estate agents on, each of whom had been a former president of NAREP, the National Association of Hispanic Real Estate Professionals. And we had this great conversation about how, and they said 2040, but I think it depends on, what study you look at. Some say 2050, 2040, but regardless, Nashville being one of the fastest growing places for particularly young Hispanics, how the Hispanic population could be in the majority in 2040, 2050. And it made me think about what I had read about when you were managing the health crisis in COVID, all of the different immigrant communities that you were having to work with, and how I read some stats like that, by early April, that the percentage of those 55 and older who'd been vaccinated was similar among the white, Black, and Hispanic communities. That for 75 and older, there was actually a higher percentage of Hispanics vaccinated than whites, and that we were one of the first of the 10 largest cities in the Southeast to have vaccinated 25% of our population. How was that for you, particularly being an immigrant yourself and understanding those communities?
So I'll say that's a year after COVID started, because vaccination started. But it's such a great, those numbers are great. I hadn't heard of them in a while, and that gives me so much pride. Here's the things, lessons learned. Just because I'm an immigrant, the trust factor with new immigrants wasn't there.
Right.
So we were able to, again, back to what you said, trust is so vital and all that. We were able to have good success with African-American community because we had churches, and we had Dr. Hildreth and Meharry kind of say, look, we got this, let us handle it. With the immigrant population, we screwed up initially, if I'm being honest. And I still remember a call I got from the leader of Turk at the time, was a good friend, who, again, I had a relationship with before, and with the president of Salome at the time, good friendship before. And they both called me, and they're like, such an angry call, I remember, but they're like, what the hell are you doing about, pardon my language here, but like, what are you doing? And they told me a misstep we had that I wasn't even aware of, right? Because, when you're finally leading a large organization, sometimes you're not aware of everything's happening, but I'm glad we got that. Here's the lesson I learned. To be able to engage with those communities, you need to find people that are trusted leaders in that community. And this is the part that I think a lot of people don't understand. You got to sometimes be okay not getting credit for empowering that, right? So what we did was we engaged with community leaders and organizations such as Turk and Salome and say, help us get vaccinated. And here's all the resources you need. So we provided all the stuff, but you guys take the lead, and you do all that, and we don't need to have a paid for by Metro Public Health, right? Like, if you're okay not always having to get credit, good things can happen. And then that scenario, that was a great lesson. And again, once you engage with the right leaders and the right trusted members of the community who'd been there before the pandemic, are still there today, that's how things got done. Not because some dude who speaks a couple of other languages and said, yeah, and I'm an immigrant, but let's be honest, right now, if I think most people saw me, they're like, oh, there's this Vanderbilt doctor who lives in Oak Hill. Yeah,
you didn't qualify as an immigrant.
And that's fair, right? I could I mean, that's a whole other conversation, but that was the perception, right? And I think sometimes you have to be humble enough and recognize that people don't need to perceive you as the savior. Like, be okay to share credit and give people the resources. And that's how we had those successes.
I'm going to switch this gears a little bit to what we were talking about a little bit earlier, which is Imagine Nashville. Yeah. So tell our listeners, what is Imagine Nashville, and, kind of, how did you become involved with it, and why do you think it's important?
Sure. So if I can give a slight history lesson, this is Nashville. So in the early, I think mid 90s, there's something called Nashville's Agenda. So there's this group of community leaders. There's when Phil Bredesen was mayor, and all the big national names, back in the day, they're like, look, we want to grow Nashville. And so they put together a really exciting goal to try to come up with 21 goals for the 21st century. And this group, they did something like what we did was they engaged the community and they came up with ideas. And some of the ideas were, we're going to expand our airport. We really would love professional sports teams. We would love a downtown library and a downtown art museum. We would love a greenway system that's more robust and a public and a housing fund like what became the Barnes Fund. These leaders back then had this vision and they built the city. So I left Nashville in 96. Their vision built the Nashville that brought me back to the city, right? I mean, I think all those things I just mentioned to you were all done. And a lot of things, if you look up 21 goals for 21st century, like a lot of their to-dos got done. It was really cool. That was 30 years ago. And that group still meets every once in a while. And they brought in more community leaders. And it was really neat is one of the neat things for me after my pandemic experience is, again, so many great people in the city. And I've been invited to meet with so many great people and be a part of certain things. So I was part of this Nashville's Agenda group. A small subset of that group, led by Judge Calloway and Janet Miller, said, you know what, we should look at how do we do the next iteration of this? And so they brought together a small group and had chancellors of the universities and other business leaders and educators and just people of all backgrounds, some elected officials. And they came up with this idea of we're going to do this, except this time we want something that guides at what value do Nashvillians really cherish, and how do we build the next set of goals based on that value? And so that group then asked me, and I said, I'll do it if Renata Soto and Pastor John Faison do it with me. So the three of us were named co-chairs of what became Imagine Nashville. And finding a name was a whole nother thing. We kind of took a while to come to that. And our goal was this. We wanted to find a unified vision for the next decade driven by these shared values that all Nashvillians have, because Nashville is very different now than it was in the 90s, to provide a single roadmap for not just government, but like nonprofits, businesses, philanthropy, to focus on and do the efforts. And so that was the genesis of Imagine Nashville, and it was a 14-month project that I'll love to dive into further.
Yeah, and I know that you guys, I think it was over 10,000 responses in 100 days. Practically, how did that work?
So the very first thing we as co-chairs did was we have to engage a steering panel or steering committee that is different than any steering committee ever. Because to be able to, again, goes back to that conversation we had around trust. If we want to engage people of all Nashville, we need to make sure that all Nashville is represented. So we very thoughtfully and painfully found about 20-something people, because you don't want to make it so big that's not effective, but you don't want to make it so small that's not inclusive. That very first meeting we had of the steering committee, not a single person, including any of the co-chairs, knew everyone in the room, which to us demonstrated, and Renata, John, and I are all pretty well connected, and to be able to say none of us knew everyone was pretty awesome, because we were able to engage the steering committee that represented political spectrums, financial spectrums, socioeconomic, jobs, all the ethnic and other demographic diversity you'd want. And so our goal was, all right, we're going to find a set of values. So we engaged with a firm out of DC or Virginia called Heart and Minds, and they've been doing this for 25 years around the whole country about finding these sets of values. And we realized that Nashville Next, which was a big thing like this a few years back, had engaged with 1,000 people. And I remember once flippantly in a meeting, I said, I want 10,000. People were like, you're crazy, but whatever, that's fine. And the way we did it was we very painstakingly went through, and some of the interviews were like hour-long sit-downs with like leaders. We went through, this was, when we started this was the mayoral election. So we met with all 9 of the major candidates who declared. We met with the current mayor, we met with past mayors, we met with business leaders, we met community leaders. And then we then had these asynchronous online things with like 500 people. And then we said, all right, we got to fill 9,600 others. So we went out and did online surveys. We did paper surveys. We did canvassing. We went to neighborhoods when we started realizing, hey, let's say I was getting a lot of my friends. So a lot of the 37215 was filling out. We weren't getting a lot of 37206. We made sure we got into 37206. All in all, at the end of it, we received 10,000 people, respondents, that was very representative of every demographic you can imagine. And we came up with a shared set of values. Oh, one thing, the thing that made us even more unique, 1,000 of those 10,000s were people between the ages of 12 and 18. The Civic Design Center was so instrumental, again, finding great partners to help you with things. Civic Design Center got 1,000 kids who are going to be the future, because what my value and what I think is very different than what a 12-year-old may value right now. And so that was really neat. And so at the end of the day, the overarching thing that was most, the value that all of us shared was that Nashville has a strong sense of belonging. And that was pretty cool.
When I read that, the deep sense of belonging and connection is what people feel here. It resonated, and I think that is why tourists feel welcome. Why people move back, why people stay. But it was I read 78% of adults and 60% of young people say that they belong in Nashville.
Yeah.
Is the young people, is that considered that 12 to 18 range?
Is. Okay. And I want to highlight, we need to define belonging.
Yeah.
Because it doesn't mean they feel a sense of belonging to Metro Nashville, right? They have belonging to something within Metro Nashville.
Okay.
So it could be their church group, their civic group, their friend group, maybe their pickleball group. But there's something that gives them this, that grounds them. That's a great word for it. And maybe doesn't give them this sense of loneliness. And kids, 12 to 18, 60% is actually, from what experts, I'm not an expert in child thinking, and I have 3 kids, you can ask them.
I was going to say that definitely proves that you're
It's a challenging thing to be an expert at.
But children that age, like, they're trying to figure out where they belong. So that number, while it's a little lower in adults, actually doesn't give concern to the people who really think through kids.
It is very fragile, though, right? I mean, we have it seemingly in a good portion, and I think what we should really, from my perspective, be focused on is that other 40%, that other 22% that doesn't have something to give them a sense of belonging. And I think it would be remiss if I didn't at least take the opportunity to say, notice those people around you and pay attention and try to help get them there. But I read that, that there was that 47% of Nashvillians, and I don't know if this is like just Nashville or if it's the MSA, are considered low income, earning less than $50,000 annually, which goes into housing and a lot of those very basic needs that we talked about. Do you know, though? I mean, I want to get you to elaborate on that a little bit, but do you know if that is the just Nashville for that?
Yeah, so it is Nashville. It's like not the MSA, but the 700,000. Yeah.
Davidson County.
So here's the thing, if I can elaborate on this a little bit. So a sense of belonging is the one thing people love about the city. 78%, as you mentioned, of adults. It's the secret sauce of Nashville. And the people did the research that there's only one community that has a similar, the North Shore of Hawaii.
Oh, wow.
Isn't that wild?
That's wild.
So here's the thing. The secret sauce of Nashville is its rich diversity. It's welcoming and accepting, supportive and collaborative, and a strong sense of community. So like, you bring a business here, and you guys have probably seen it, and people listening probably seen it. Like, oh, you want to start a computer business? You see my friend Bob over here. Oh man, Bob is great. Let me call you guys. We're going to do it right now. Mm-hmm. It's not just making an introduction. It's that warmth and making it. And that's a secret sauce.
And I say we see that almost daily, because what we see is so many people who came to visit Nashville. They came to visit for a wedding or a bachelor party or bachelorette party. They had a lot of fun. They met people, and they literally decided to move with no other connections to the city.
Yeah, it's pretty wild.
And that's a pretty common narrative. That's fascinating.
It's really cool. But to dive into your thing, we all love it, except there's a big chunk that are feeling less and less included and sense of belonging. And I think as we look forward, so as we'll dive into some of the priorities, we look for how do we impact those people. So number-wise, 57% of those people that made less than $50,000 as a family felt that they weren't less and less belonging to the city. And as you point out, and it surprised all of us, not surprisingly, Mayor O'Connell was the only one of people like quiz. I love quizzing people. I'm like, my professor, I'm like, Mayor, do you know how many people make less than $50,000 in the city? And he was like, he knew it. Of course he knew it. Most people don't know that, myself included. The steering committee, we're like, no, there's no way.
So
47% of the city makes less than $50,000.
I thought it was a typo when I saw it.
We did too, but we've vetted it, and there's the other two communities that also feel, so 57% of people. The other two communities, and we can dive into the data all you want, but older Nashvilleians, those over 65, 45% of those people don't feel a sense of belonging. And then our LGBTQ neighbors and friends and families, 48% of that community don't feel a sense of belonging to Nashville. And that could be, is it the city? Is it the state? That's hard to decipher. But at the end of the day, these are Nashvilleians who don't feel a sense of belonging. So those are three groups that really highlight in this group.
Yeah. Well, you know what's interesting about that? The income figure is that while it's not, so I don't know if this is, based on, a family of four or an individual. Do you know if that's 50,000 annually?
I think it's a little mixed.
Yeah.
It's a little of both.
But
I would guess it's household. Just because
that's my guess too. But
yeah. But so while it's not poverty level, it's well below kind of the minimum standard of what you need, which I think is for a family of four, maybe around 80,000 or something, that they've mid 80s. So, yeah, it would be hard to, again, you've got that list of priorities that I need to be happy, and I'm not getting a lot of those basics met. So that sense of belonging, it's maybe not even registering to me yet. Okay. So I will quickly read the final recommendations that emerged, and then I want to get your thoughts on those. But, that all Nashvilles have meaningful and accessible pathways for a higher standard of living, an essential ingredient for good life. I guess, what does that mean? Maybe we'll just go one by one.
Yeah, so really what that means is kind of we need to be more intentional about the kind of economic development we're prioritizing, and then make sure Nashvilleians are better positioned to get that higher wage job. So at each of these four priorities that we'll go through, there's about 30 plus action items that I encourage anyone to go to imaginenashville.org to see our full plan. And so in this area, it could be everything from, what a big problem is childcare. Like, it's really hard to get a job if you can't get childcare. So that's one. Educational opportunities within, for training after high school, making spaces so small businesses can thrive. So lots of recommendations, but those are the types of things I'm referring to.
Yeah. And so then second one, our transit system allows us to move about the city safely and efficiently. Hopefully we're about to make our first big step toward that by the time this is out. We'll see.
I hope so. I don't know if you guys realize, I chaired the mayor's transition committee around transit.
Okay.
So this plan is really cool seeing it come to fruition, and what he's done and his team have done. So I hope so. I'm biased.
We have ample, attainable, and affordable housing options that match demands and meet our needs. So I think we have a little bit of a sense of affordable housing and transit. It's being talked about. I don't know how we're going to solve the affordable housing challenge quickly enough, but I know that we've got a lot of smart minds working on it. What about this? Each neighborhood has a distinct character and fosters a high quality of life for residents.
I think that is, for me, one of the cooler things that came out of this. Funny enough, around the same time this came out, or before it came out, we actually met with John Ingram and talked to him about it. And at the same time, he was like, the Nashville Soccer Club picked up on the fact that people are so proud of their neighborhoods. Sense of belonging, people have they're proud of their, they may not feel like they belong to Nashville, but man, they love Inglewood. Or man, they love East Nashville, or they love, I don't know if we walk around boasting about Oak Hill, but you know what I'm saying? But people are proud of their neighborhoods. So this was a really important thing, and we want to make sure each neighborhood, we don't lose that uniqueness of each neighborhood. But each neighborhood, there are things that people find important, like third spaces where people can play outside of schools, where sidewalks with lights. So the with lights part was really a nuance that I thought was interesting. So sidewalks alone, maybe not, it's important, but have lighting, have better ways to leverage state and federal neighborhood revitalization funds. There's also things to do, but we cannot lose the uniqueness of the different neighborhoods we have in Nashville. The reason I mentioned the soccer club is this season they started having patches for each neighborhood, so you could buy your neighborhood patch and wear it on the uniform. So the smart marketing people of the Nashville Soccer Club have already picked up on that. This is a big value that Nashvilleians have, is their neighborhood and their pride. And we're just highlighting it.
Yeah. That makes me think, it's kind of a funny just reference, but when we're sitting in East Nashville here today in Laughlin Springs, 37206. I remember when we first opened our business, the most popular bumper sticker, I think at the time, basically said 37206 will steal your heart and your lawnmower. And that really captured the pride in the neighborhood, though. And, kind of the roots of the Tomato Arts Festival, which has become a really, really cool festival now.
I think it makes a lot of sense because, we can't, depending on where you are in the business community and the political community, you might not feel like you have much control over, higher levels. But I think whether it's your street or whether it's, 2 or 3 neighbors next to you, you start small. And so it makes sense that you would take pride in your school, in your neighborhood. And it's like, I fit in because I am here.
Yeah.
Kind of piggybacking again on the kind of what we're talking about with studies, so Nashville, I think we're really good at doing studies.
Yeah.
We do a lot of studies. We have a study for a study on transportation. Next steps for Imagine Nashville. We understand how Cato and the Community Foundation, Middle Tennessee are working on next steps. What will that look like, and kind of what's the best case scenario?
Yeah. So your question is such an important one, and one that honestly we wanted to get right. There are so many, like you said, studies, and I should go back to this funding for this came from philanthropy. It came from universities. There's a lot of interest in this, and we want to make sure we did it in a way that was very open. What we also want to do is to our funders was to make sure that, to your point, we don't have a plan that just sits on a shelf. So it's so exciting to me that we're making these community implementation teams. So it's not just Hal, who the Community Foundation is critical, but it's also with the mayor. So each of these 4 priorities will have community implementation teams that are public-private partnerships. So people from the mayor's office and the people within the community, so philanthropy, people who like nonprofits. Because to your point, there are people who've been thinking about affordable and attainable housing for a long time. How do you bring all these people together, have them continue work together, and then equally as important, have a tracking mechanism. So we're going to have a way that you can track these results. I think we're going to work with the Belmont Data Collaborative so that you can access progress. I also would welcome people to go to imaginenashville.org right now and look at the data. Because we had 10,000 people respond, you can go and break it down by neighborhood and see all the different values people have. So it's a huge data thing that you can just go to right now. And to summarize, like having the mayor's office and Hal, who is a big doer, as you know, having those 2 people work together, I think it leads to a lot. And especially what's cool is like we're so early in Mayor O'Connell's administration, right? I mean, I hope also that his transit thing passes next week. But then what was really neat, if I can digress for a second, when we had our meetings with the 9 mayoral candidates, the one mayoral candidate that gave me the most heartburn, if he got elected, was Mayor O'Connell, about supporting this. And it's not because he's a chump, he's far from it, right? It's because he asked really hard questions. He's like, all right, so to your question, like, what is this going to tell us? And what's been really neat is working alongside him. And as this results came out, and he and I chuckled once, what we found as important things in the research essentially was the stuff that he, as a mayoral candidate, was running on, right? And that shows again that he has a great pulse of the city and the community, and his heart is to improve these things. So it's just coincidence, but it's really nice. There's a lot of parallels between the mayor's objectives and priorities and what Imagine Nashville demonstrated, and the fact that he and Hal. So Imagine Nashville proper is gone. In fact, I just deleted my Imagine Nashville email off my Outlook today. I kid you not, just this morning, because every time I log on and say you need to put a new password in, it's because it's done. But now the public-private partnership, I hope, will then lead us to that 10 years from now, when my kids are looking back, I mean, more than 10 years, to where are we going to come back to? I hope that they come back to Nashville because of the work we did today, leads the foundation to the people who 30 years ago did the work, brought me back. And Brenda Wynn was on that committee 30 years ago. She's on our steering committee this time too. Yeah. So there's that continuity there too.
Yeah. And I think even for both of us, kind of what you were saying about, kind of the rise that Nashville has had, right? So like, I graduated from law school in 2001 and really thought Nashville was kind of an afterthought. I grew up in a small town in East Tennessee and remember, clerked in DC and Atlanta and Charlotte and, some big firms in big cities. And, I had an aunt that was here that said, you should give Nashville a try. And there were so many cool things starting to happen. That was when Bredesen was mayor. and it just had like an energy that, I think that summer, you as a law student, you often work in a law firm, you're a summer associate, you kind of get a sense, would you like living in this city? Would you like working at this law firm? And there were things that were happening. And I think the class that I clerked with, almost every single person decided to come to Nashville.
Oh, neat.
Yeah.
And I think you had a lot of fun too doing here.
Yeah, no, great.
And it sucked us in, and that's how we ended up here.
Is this a little bit like, Partnership 2030, only on a people level? Like how Partnership 2030 with the chamber, more on a business?
Well, yes and no, right? So I will. Partnership 2030 is an important component of our priority about giving Nashvilleians meaningful, accessible pathways to a higher standard of living. What we hope to do if we do our job right is, again, we highlight the priorities, and there's some really great people and efforts on those. And so we want to include initiatives like Partnership 2030 to this. And so Ralph has been really close with us and has worked with us on this. So I hear what you're saying. I don't know if I'd say it's that for people. I think this is it for Nashville. And if done right, the implementation of some of our priorities will take into effect all the great work that's already been done by whether it's Partnership 2030 or whether it's people working on affordable housing or some of the workforce development stuff.
Hotspot, a doctor's diary from the pandemic, released a little bit after the pandemic. Tell us about that, because it's gotten lots of good PR out here.
What made you want to write a book?
I mean, so here's the thing. I kid you not, I have no desire to want to write a book. It was never an intention. About 6 months before the pandemic, my wife's grandfather passed away, and I'd never met him. He had dementia. He lived in England. And when he passed away, my mother-in-law pulled out all these letters from World War II that he had written her mother. And in those letters, you could hear his voice and hear his story, and like he was a pilot and all. It was so freaking cool. When the pandemic hit, I had a kindergartner, a first grader, and a third grader. And again, as we talked about at the beginning of this, we all thought this would be a few months. And I was like, early on, I recognized that what I was doing was totally different than anything I'd ever done before. So I had a little black and white composition book in my office. And the only reason I had this is every patient I operate on, I put a sticker in a composition book. So I have a list of everyone I've ever operated on. I'm not a journaler. I'm not a lawyer. Like I'm very, if you think about trauma surgeons, stereotypically, that's who I am.
Yeah.
But I realized that I wanted my kids to maybe have a record of what I did in a month or two that I was going to do it. So every day, at the end of the day, I'd write the date, I'd write the number of cases, number of deaths, and kind of what the problem of the day was, what we did for it, and outcome. And like a little blurbs, right? And sometimes, I kid you not, a couple times it's in crayon, sometimes it's in pen, whatever I can get my hand on. A year plus into it, by this point, I had a machine around me, right, of PR people and everything. Like at a certain point, you realize like you get handled pretty quickly when you're out there all the time. And I want to give a pep talk, and it sounds cheesy at the time, but I was like, team, I was going through my notebook of all that we've done, and let me just read you some of the stuff we've done. And one of the people, she's based out of Chicago, she's like, wait, you kept a book of every day? I'm like, yeah. She's like, we should write a long form article for like the Atlantic or something about this. And I was like, okay. And so she's like, send me the thing. And my handwriting is really bad. And I was like, well, I can't send it to you. So I dictated the whole journal. I sent it to her, and she's like, oh man, this is amazing. And so she's like, why don't we take a few of the excerpts and you build upon it? And I built upon it. And then next thing you know, people are like, this could be a book. And what it is I take the pandemic for 1 year. So from March 7th to March 6th. So 2020, 2021. And I just talk about not only our experience, I really became a 1 year history of Nashville, because in that year we had obviously the pandemic, we had the bombing, we had the retro winds, we had
the tornado, which hit this neighborhood.
We had craziness that happened around the pandemic. We had the Floyd stuff that happened, right? Yeah. And we had the downtown the courthouse get fired and stuff. A lot happened in that year. And so I just started writing, and it's not a diary. Like I should have brought you guys a copy. I'm sorry I didn't. I'm totally gonna get you guys a copy. But it really, what I hope is it's a snapshot of the year. So, and it was in real time. It was really neat and still very humbling for me. Is there was a person who wrote a review about it just within the past month or past 2 weeks. And this reviewer said, and it was somebody like in another state, fascinating to find it, But the reviewer said I believe it was a gentleman, what he liked about my book is right now there's a lot of books coming out about the pandemic that's retrospective. Mm-hmm. Mine was very prospective. This is what happened. This is why we made the decisions we made. It doesn't color it in hindsight, right? Like there's a lot of things I could have colored in hindsight, but it's about the year in Nashville, and I hope that I still hope that my kids
documentary style is what I really visualize.
Yeah, and I still hope that it's the mission of just wanting my kids to have a story of what their dad did in that year is thing. And what's been wild is it's gone all over. I had a cousin who was in a bookstore in Oregon, and she saw my book on the shelf next to like Atul Gawande, which for medicine is like a big thing.
Oh, it's so good.
I got to go to Politics and Prose and do a book tour there, and went to Chicago. It's so humbling. It is so humbling for me. And fun, you said Vanderbilt University Press. Vanderbilt University Press actually does not like publishing authors who are faculty members. Mm-hmm. And so they rejected me the first time and two. And then I realized I just wanted to get out there. So I didn't really care if I had a New York publisher, but the University Press is an amazing place. But VU Press really focused on stories about Nashville. So once I said, look, this isn't a story about COVID, it's a story about Nashville at this time. Amazing people. Betsy Phillips, who just wrote a book, helped me with it. And Gianna Moser, who runs it, like they're so supportive. And it's again, I mentioned to you before we got on there, I feel like I'm Forrest Gump because I've had all these amazing opportunities, and that was another one of them.
Yeah.
It's really cool.
Well, I think, I think saying yes and being open to those opportunities when they come is really, that's a key. And in Nashville, I just want to point out again, like, I feel like, it's very easy to look around and think, oh, this person is younger than me and they've done more than me, or this is this. But what I've found just in the last couple of years that, Brandon and I've been interviewing people or getting out there is like, Nashville is just such an open place. Yeah. Again, we did not know each other before now. I now feel like I know you and I, look forward to seeing you outside of this setting. And it was not difficult. It's like, hey, would you come talk to us for a little bit? Yes, absolutely. Like, great. That's just who we are.
Yeah.
Okay. So some lightning round questions that may or may not be lightning round, but just to wrap it up, the name of a book besides yours, potentially that every person should read.
I literally just finished this book. It's called The Happiest Man on Earth. Have you guys heard about this?
I've heard of it. Know nothing about it.
It's first of all short, which my attention span is low. It's about this gentleman who lived the Holocaust, lived through it, and he grew. But it's like how he kept his happiness. And at first I was like, I don't want to read about it. And the Holocaust is hard, right? We all know that, right? But man, it just wow. It was really that was a book I just finished. My most recent book I finished, and I highly recommend it. It's just, think about going through the Holocaust and how he kept his spirits up, and how even during the moments of adversity, he ended up, living to 102, 107. I forgot the age.
Wow.
And just, it's a really good book.
Yeah. I think about, again, just things that, again, like that we take for granted that he probably never took for granted again. Yeah. Just like you said, like breathing there. Yeah. When you said Atul Gawande, Being Mortal.
Oh yeah. What an amazing book. So
it really changed my life.
Now I want to interview you about why.
No,
it really changed my life as a physician and as a son, because, so Being Mortal really talks about end of life, and I'm a trauma surgeon. Like I deal with a lot of that. And that book, when I read it, it made me ask the why. Like, what is it that you want to do? And I've had this conversation with a lot of people. I had a patient actually her family member gave it to me, not realizing I'd read it, because the conversation I had with a patient, it's like, at the end of the day, it's like, what is it that you want your life to be? And if you're okay being paralyzed and watching football all day and that brings you happiness, then who am I to say that's not the right life to have? Right. And that's a really powerful book. Really powerful, and sort of almost like medicine is not, it's not a one size fits all, and sort of envisioning what you want and having those conversations, which are so hard to have. It's such a great book. Very powerful. I'm actually excited now that you've talked about Derek. What is your morning routine between the time you wake up and the time you arrive at whatever your work may be that day? So typically I wake around 4 in the morning.
You text Derek at 4 or like he's probably still in bed?
I'll tell you, he is in bed. Derek is, but I will tell you this morning, Derek and I's text message occurred. It was a little later. It was about 6 something this morning.
6. I guess kids are getting you up.
Yeah. So here's the thing. I wake up around 4:30, and that's really the only like quiet time I have. Although work sometimes calls me then. Cup of coffee. I go through 3 newspapers and TV. Often do something real quick as far as like work emails or something, and I work out. And then by the time I finish working out, the kids are usually awake. And then I'll try to do what I do. And if I'm on call, I'll be in the hospital by 6:30. If I'm not on call, the great thing about where I work is right across the street from where my kids go to school, and I try to take them to school. And that's my morning routine. But a lot of reading and a lot of just thinking about what I need to do.
Yeah. I feel like that's the key to success is just planning your day, which I am terrible at. And so then what time do you have to go to bed to get up that early?
I usually go to bed around 10:30, 11.
You don't sleep a whole lot.
I'm trying to, my to-do this year is to be better about it.
And how do we balance it all? Because then there's all the, all the podcasts, all the things coming out. It's like, sleep is the most important thing. Yeah. It's like, but how am I supposed to like get my eyebrows waxed and work out? And
I mean, it's hard, right?
Yes.
I mean, as you see, I haven't had eyebrow waxing in about 46 years, but it is hard. But I have focused on sleep. I'm like buying into all this stuff. Like I bought this like thing you put on your mattress. It keeps your bed cool. And I've done all this stuff.
Set the temperature like basically as low as everything. You can tolerate it.
Yeah, life is full of just pushing and keep trying. It's okay to fail once in a while because I fell a lot with this sleep part of it.
Favorite way to relax or unwind from a stressful day?
Oh man, you know what is funny? So I wear an Oura Ring, back to all these tools. Yeah. The Oura Ring has a thing where it shows you you're very relaxed. I don't know if you guys have them, but one of the things in the app is like, this is the moment when you're most relaxed. The thing that always appears to make me most relaxed, I'm sitting there watching TV. And it's the weirdest thing because I never thought that is, but I mean, I should give you an answer like hanging out with my kids and stuff like that. And those are great. I like hanging out with kids, but I really think I want to just sit and watch TV or watch like TikTok. Can I admit that? Mm-hmm. Watch TikTok and just, I have a whole thing that I do with my cousins called, it's literally called Amir, so they call him Alex's memes. I just send memes all day, all night, not all day. That just makes me, I just like to be mindless once in a while, and that's what I do. And
it's important counterbalance too.
It's so, and there's some funny stuff out there. I don't know how these people spend so much time.
So funny. I mean, like you can just really just sit there forever. And I use TikTok a lot for, I tell people it's like a way better YouTube. If you want to know how to do anything, you just go on there and it's like, you don't have to hit play, wait for like 5 minutes. You're like 2 seconds in. No, I mean,
it is a drug for sure. So I'm trying to get better about it, but it is my guilty pleasure.
Yeah. Well, I actually really appreciate that because it's like when everything else is done, then I sit down and I watch some kind of trash TV and it's just a perfect zone out.
Yeah.
Maybe we can count that as sleep.
I mean, according to the ring, it's when I'm most relaxed.
I like it. Okay, so we understand you have 3 girls. Brandon has 2. What is your best advice for girl dads?
Honestly, just to be a dad. So one thing we do with our kids, we made a goal about 8 years ago. We wanted to hit all 50 states with them. Yeah. And we just finished it last week, which is really cool.
My kids, my 11-year-old's at 49 states. So
it's a great goal. So for me though, my wife will laugh. If I look at my wife, I said, what do I say all the time to my kids? And she'll tell you, it's suck it up. Like, I just want them to just kick tail. And I want them to just want to be good people that have the ambition and the drive. And it's okay to have that. Yeah. And I'm totally fine with that.
So the doctor says, suck it up.
Yeah. And I think that's I think one thing, is a real challenge is, I think if you think about your youth and sort of the adversity and the challenge, it kind of may create drive that's hard to recreate, right? So your kids have a lot more comfortable life. We talked about that a little bit earlier.
Well, yeah, Brandon and I talked before you came in, and I just said, comfort is really the enemy of progress. Yeah. And because we were talking about how much you had done, Brandon was looking, he was like, wow, this guy really makes you feel like a schmuck. And it's like, and so that prompted this conversation of,
so we were talking about how do you instill those same things that kind of gave you that drive in your kids that I think that's really hard.
By giving them the credit card to Sephora, duh.
That's right.
Yeah, apparently that's the thing. My kids will do their skincare routine on me. I'm like, are you kidding me right now? Like, you're 11 years old. You don't need a skincare routine.
Yeah, both of my daughters are obsessed with Sephora.
I mean,
Obsessed.
yeah,
Like
they're brilliant marketers.
Collect stuff.
The secret to your good-looking skin is the fact you're 11. Let's just be honest. It's not Sephora. It could be Tartar from the street. It doesn't matter. You're 11.
Yeah, you're just 11. You look beautiful. I saw, Keith Urban, Nicole Kidman, and their daughter Sunday, I think, had done a fashion show, and she'd been recorded, and they were talking about like her voice, how it's got this like little bit of a Southern twang and a little, maybe Australian in there. And, he was asked on some late night show about it. And he said, it's just our daughter.
That's right.
And so I go back to your original, just be their dad.
Yeah.
And so who should we do this with next?
Well, I mean, it sounds like you've done Hal. I really I found Bill Frist very fascinating.
Yeah.
I don't know if you guys have done one with him yet.
No, we haven't.
Because he and I, because it's not, so it's, you think about Bill Frist, the senator, you think about Bill Frist, the venture capital guy. Do you think about Bill Frist, the Nashville Health guy, who I'm on his board of Nashville Health, full disclosure, Bill Frist, the chair of the Nature Conservancy, right? He's a very fascinating dude.
Yeah.
And for me, we've developed a relationship, but I remember meeting him as an 18-year-old, just at like a Senate, like, here you go, here's a picture, move on. And it's just, what a neat, I think he's very interesting to me.
One great Bill Frist story just was, we worked on this book, which this podcast really has grown out of, and we haven't had him on the podcast. Remember, we have a chapter about healthcare. And I think Angie had sort of emailed the draft and said, hey, here's kind of something we're working on. And he literally edited it and sent back with all kinds of comments, which was incredible.
He likely was just like, oh man, these guys.
It's been fun to develop a relationship. Ken Levitan, you know him? He's in the music industry.
Okay.
And I've met him, and I've met him a few times, and we've do a few things together. What an amazing person. And I don't actually fully appreciate what he does. And I'm listening to
NPR,
and there's this rapper talking about this guy, Ken Levitan. I'm like, what? How did you? It's just, he's a person who, I don't know the music business, so I don't even want to pretend but he's apparently a lot of success in that world. But he also is somebody who's given so much to this community in nonprofit work, and just, and I'm sure so much I don't even know that he's done. I find him very fascinating.
Those are the fun ones to explore.
Yeah,
that's awesome.
Yeah, and just a really, really nice guy.
That's awesome. Thank you so much for joining us today. This has been great. And thanks everybody for listening to another episode of Climbing the Charts. We will catch you next time.